Come in.
Hi, I'm Alex. I'm going to be your nurse for the day. Hand hygiene, putting on gloves. Can you tell me your name and date of birth?
I'm Daisy Delilah, 12XX.
Okay, and can you tell me where you are right now?
I'm at Enloe Hospital.
What day is it?
Wednesday.
Okay. Any recent events that you can remember?
The Lakers playoff game last night.
Okay, who won last night?
The Lakers.
Okay. Can you tell me any allergies that you have?
No allergies.
Any medications?
I can't remember them.
Okay, we'll get those later. What was the reason for you coming into the emergency department today?
I was feeling really dizzy and the room was spinning.
Mm-hmm. And when was this?
It was this morning when I was waking up and getting out of bed.
Were you doing anything else when this happened?
No, just getting up.
Okay. Any other symptoms?
No.
Okay. And how long did this last for?
A few minutes.
Okay. Did you happen to fall or lose consciousness when this happened?
No.
Okay. Now I want to ask you a couple questions about your chronic health history. Do you have any history of heart disease?
No, I do have high blood pressure and high cholesterol.
Okay. And what about COPD or asthma?
I have stage 1 COPD.
And no asthma?
No asthma.
Okay. What about any history of strokes or seizures?
No.
Okay. Any history of diabetes?
No.
Do you feel recently any fatigue?
No.
Any history of headaches or dizziness besides today?
No, not before today.
Okay. Any difficulty swallowing or speaking?
No.
And just real quick, I want to feel under your neck. Can you swallow for me real quick? Okay. Have you had any history of losing consciousness?
No.
What about head trauma or falls?
No.
You know, history of any of that?
Mm-hmm.
Okay. I want to also ask you a couple questions about your day-to-day function. Do you walk on your own?
Yes.
You don't have any difficulty walking on your own?
No.
Okay. You don't use any assistive devices such as a walker or a cane or a wheelchair?
No.
Okay. And what about your day-to-day activities such as brushing your teeth or bathing yourself? Do you have any difficulty doing that?
No.
Okay. And do you have anyone living at home with you to take care of you?
No.
Okay. I also want to do a cardiovascular assessment as well as a pulmonary assessment on you. And then after that, I'm going to do a neuro assessment. So real quick, I want to look at your lips and see if there's any blueness or cyanosis there. There isn't, so that's a good sign. Can you open your mouth for me real quick? Looks good. Looks like there's moisture in your mucous membranes. And there's skin turgor right here too, which means that you're hydrated. Now I'm going to look at your extremities right here. And real quick, I'm assessing and feeling for warmth and cap refill. Cap refill is less than 2 seconds on this hand and less than 2 seconds here. I'm also going to feel your pulse for 30 seconds here. It's good there. +2 bounding. And here too. That's a good sign. I also see no cyanosis or discoloration in your hands, so that's also a good thing. And I'm going to move to your feet real quick too to check that. I'm checking the cap refill in your toes, which is present and good. I'm also going to feel for your pedal pulses, which I can feel. And your feet feel warm and there's no discoloration or blueness in your toes or anything like that, so that's always a good sign. Now I want to check your for any swelling in your ankles or your legs. So I'm going to feel around here. Let me know if there's any pain. Feels good. No swelling. No discoloration of any sorts. And now I want to take the time to listen to your heart sounds. You don't have to do anything but lay there. Your heartbeats sound regular. They don't sound I don't hear any abnormalities. I also don't hear any abnormal heart sounds. Do you have any chest pain by any chance?
No.
Okay. And now I want to move on to the pulmonary assessment. Do you have any chest tightness, difficulty breathing, shortness of breath?
No.
Okay. Do you have any oxygen at home?
No.
Okay. What about smoking? Do you smoke?
I smoked for 40 years.
Okay. And do you still smoke?
No.
How often did you smoke when you did smoke?
Every day.
Okay. And you don't have any difficulty breathing when you're moving around or exercising, correct?
No.
Okay. I'm going to listen to your lung sounds real quick. Can you sit up for me? Thank you. Just take deep breaths in. Again. Again. One more time. Let me listen to the back lung sounds as well. Okay, you can lay back down now. Your lungs sound clear and they sound normal. I don't hear any crackles or wheezes. Your chest expansion looks symmetrical and I don't see any use of your accessory muscles, which is a good sign. I'm gonna palpate real quick. Let me know if there's any tenderness or pain where I'm touching, okay? Nothing?
No.
That's a good sign. I also want to look at your fingers and check for any clubbing of the fingernails, which is not present. That's a good thing also. Once again, there is no blueness or cyanosis on your fingers, and no, it's not pale. So now I'm going to move on to the neuro exam. And so for that, I'm going to use my pen light, which is just a normal pen because I lost my other one, so let's pretend. Can you take your glasses off for me? I'm going to shine this light in your eyes. Just look straight ahead. Okay. Okay, your pupils look equally round and reactive. I'm also going to test your mental status real quick. Can you just quickly count down from 5 for me?
5, 4, 3, 2, 1.
Okay, and I've already tested your level of consciousness and you're alert and oriented, so I can finish off the rest of this test. I'm going to feel around right here for this cranial nerve. Can you open your mouth for me and close? And there is no clicking or anything, which is a good sign. I'm also going to ask you to sit up for me and raise your shoulders. And I'm putting resistance, and you're still able to do that with no difficulty or pain, correct?
Yes.
That's a good thing. You can lay back down for me. And smile. All right, your face symmetry is equal. There is no eye sag or drooping or anything like that, which is a good thing. And now I want to look at your range of motion. So can you raise your arms up for me and out to the side? And you can put them back down now. And can you bring your knees up to your chest too? And you can bring that back down. Any difficulty or pain with that?
No.
Okay, now let's check your head and neck. Can you look up and down? Can you turn it side to side? And then touch your ears to your shoulder. Any difficulty or pain with that?
No.
Okay. Now I want to do push and pulls. So can you squeeze my fingers? And then push and pull. All right, those are normal findings because I can feel it. Now let's do your legs real quick. Push your toes. Now pull. Okay. And do you have any numbness or tingling in your feet?
No.
Any numbness or tingling in your hands?
No.
Okay. Now I want to assess your balance and coordination as well. So if you can just stand up for me. I'm going to do the quick Romberg test, which is just closing your eyes and seeing if you sway or anything when you're balanced. Okay? So just close your eyes for me. There is no swaying, which is good. Now I want you to open your eyes for me and touch your finger to my finger and back to your nose. Okay, your coordination looks good. Now let's do the other hand. Finger here to your nose. Coordination still looks good. Now let's see how you walk. If there's any loss of balance there, so just take a couple steps. Looks good. All right, you can lay back down now. I think there are no abnormalities or anything that I've noticed. So what I would say is as you get older, you do experience more dizziness and and you are more prone to falls. So I do recommend that when you do get up, you get up slowly and you take your time with it so that you don't experience these dizziness and the room spinning. Do you have any questions for me?
No.
All right. I'll be back later. Here's your call light.